Do you have a pain in like the ball of your foot and you're wondering what is going on? Maybe you feel like you're stepping on a pebble or just like there's something in your shoe constantly and you're wondering why you have that problem and what you can do about it. So today we're talking about metatarsalgia, which is pain in the ball of your foot. We're going to talk about what causes it, how long it takes to heal, and what it is you need to do to deal with this metatarsalgia, or pain in the ball of your foot. All right, so first thing, what is metatarsalgia? Well, it literally is pain in the ball of your foot, but let's explain where the name comes from. So this is a right foot, this is the bottom of the right foot, and these bones right here are called your metatarsals. The metatarsals are the connection between the foot and the phalanges or the toes. So metatarsalgia is literally pain in the metatarsals. Metatarsal, algia, pain. So it's pain right in here. And usually it most commonly occurs in between the met heads or right over the met heads. Now, some of them have fat pads on them that can get inflamed. It still technically would be considered a metatarsalgia because it still is caused by the same problem. But it can also be that there's a ligament, there's this huge, really, really thick ligament that runs in between all of these. And it can get really stressed at times and really inflamed. And of course, it's a ligament in the foot, so it's really far away from the heart, and it can be difficult to get that to calm down. But most people talk about pain that at least starts in the ball of the foot, and that's what we call metatarsalgia. Now, obviously the plantar fascia attaches to these met heads as well. So you may have pain that starts here, it ends up affecting the plantar fascia because you change how you're walking because you're in pain, and then it becomes a plantar fasciitis as well. But plantar fasciitis usually starts back in here, more towards the heel. Metatarsalgia starts up here by the met heads. They can both end up affecting the plantar fascia, but there's one that usually causes pain as opposed to the other. So what causes metatarsalgia or pain in the ball of your foot? Well, there can be a number of causes, but most commonly it has to do with the shape of your foot. And it most commonly is with a very, very flat foot. Now, my friend here has a very, very flat foot, as you can see, as well as something protruding out of the heel. That would hurt, right? But you can see that there's not a huge arch in here. And a lot of people with metatarsalgia or pain in the ball of their foot have a very, very flat foot. So that puts increased pressure through all of the structures that are on the bottom of the foot, including that ligament that binds those met heads. Now, the other people who can have pain in the ball of their foot is people who have very, very high arches. Those people tend to suffer because their met heads, or right here, the base of their toes, takes a lot of pressure when they're walking because it's not evenly distributed throughout the arch because they have that really, really high arch, which will become very, very rigid. So it's difficult for people who have really, really high arches to get that full push through of their foot like they're supposed to because they just have a lot of stiffness. Now, some people will have pain in the ball of their foot because of the surfaces that they're walking on. If you tend to be more on concrete, if you tend to be standing for prolonged periods of time, also if you tend to go up and down ladders a lot because that puts a lot of pressure through those met heads as you're going up and down the ladder. It's not like you can evenly distribute your weight while you're walking up a ladder. But if you tend to have occupation or hobby that has a lot of those activities, it can put a lot of stress through those met heads and cause an inflammatory process to start that will make it really, really painful through the ball of your foot. That's why it's really important, as much as you can, to stay off of really hard surfaces like concrete, at least for prolonged periods of time, and definitely make sure that you're not standing on them for a long time. Although if you need to do that for your occupation, don't worry, we have some ideas at the end of this video that will be just for you. So, what does metatarsalgia feel like? Well, most people describe a feeling of a pebble in the ball of their foot. So they feel like initially like, oh, I got something in my shoe, there's something going on, like I stepped on something wrong. If you're walking barefoot, you may feel like, oh, I stepped on something wrong, except for like there's nothing there that you can see. If you're wearing your shoes, you may feel like you have something in your shoes and you go to, dump it out and see, and there's nothing that comes out. And it doesn't matter what shoes or slippers or barefoot or anything, it doesn't change. So that's how most people describe it initially. Some people also have pain in there. Most commonly it starts as kind of a low-grade pain. It's more the sensation of that pebble in the foot that they notice initially. The pain will come later. Now, as the pain develops, it may become like an electric shock pain. So obviously we have nerves in our foot. So as that pebble grows or it gets more inflamed, it can start to affect the nerves that are in our feet, which will cause that electric nerve type pain. If it's gotten to this point, it's pretty aggravated and you really want to do some aggressive treatment to get it to calm down. Once those nerves are irritated, it gets to be much, much more difficult to deal with it. So if you just have a pebble right now and you're like, oh, I don't really have pain, it's not that big of a deal with it now, because you really don't want it to get worse, because when it gets worse, it really gets worse. The other thing that we're concerned about with metatarsalgia over a long period of time is that inflammation can cause the ligaments to be more lax, and it can predispose you more to stress fractures. And stress fractures, if you've ever had one, they are definitely a challenge because there's literally nothing you can do. If you get a stress fracture in your foot, you're getting put in a boot at best, potentially non-weight bearing at worst, and you're on crutches for a minimum of 6 weeks most times. It is really, really challenging to deal with stress fractures in the feet, and there's really nothing that you can do about it. Stress fractures, you just have to wait until they heal initially. Now, there's some things you can do soft tissue-wise after it's healed, but while the stress fracture is healing, we leave it alone because we want to make sure that the body has a full and complete chance to heal. So we don't want you to get to stress fractures. We don't want you to get to shooting, nervy, zinging pain. So please listen. If you just have a sensation that you're walking around and there's a pebble on the bottom of your foot, treat it now, because when it gets worse, like I said, it gets much, much worse. Now, for some people, they will only have the pain in the morning, or they'll only have the pain while they're walking around barefoot, which of course means that they're going to walk around in slippers or sandals or shoes or something like that. And they feel like, oh, the only time I feel it is when I'm in the shower or first thing in the morning when I'm getting out of bed. And it doesn't really seem to bother them that much throughout the day other than that. This is a good sign because it means things are just starting, but it definitely means you want to take some steps to work on treatment now, because the sooner you start treating this, the sooner it will go away and it will keep you from getting those really, really bad symptoms. But if you have pain in the morning that's in the ball of your foot, that would be a metatarsalgia, as opposed to pain in the morning that's more in your heel. That more than likely is a plantar fasciitis. And we did a whole video on plantar fasciitis, so if you want to check that out, you feel like your pain is more in your heel than the ball of your foot, then I encourage you to check that one out right over here. All right, here's the question that everybody always wants to know. How long does it take to heal, completely heal, a metatarsalgia or pain in the ball of your foot? I told you guys earlier, it takes a while to heal this, and it's so important to stay diligent to the program that you've created that we're going to outline later, because it's really slow and steady progress that we're looking for. What we want to see is that things feel a little bit better every day. I usually recommend that people notice the pain they have first thing in the morning. That's the good litmus test, because that usually will slowly get better over time, but it takes a while. So if you have metatarsalgia, chances are good that it will take a minimum of 6 weeks for the pain to go away. Now, if it's gotten to the point where you're having shooting nerve pain, obviously if you have a stress fracture, that's gonna take 6 weeks to heal on its own, but it's gonna take a minimum of 6 weeks for you to feel like a decrease in that pebble in the foot. And it's really important to stay diligent during that entire time. You should notice some small changes from day to day, but we're going to take the turtle pace here and just make sure we continue feeling a little bit better each day. Now, if you continue being very diligent with the program, within 3 months, you should definitely notice that all of your symptoms are completely gone. Even if you've had some shooting pain or it started getting achy, that pebble should be gone. You should definitely feel like, okay, I'm ready to return to my previous level of activities. Of course, slowly progressing back into them, making sure that you don't have any problems when you do it. And here I'm definitely talking to my runners, because my runners, you know, they take 6 weeks off from running and they are so excited to get back to it, and they want to get back to running the distance that they were running before they had this problem. And I get it. I'm a runner. I totally understand. But if running is what started this problem in the first place for you, then you definitely want to get back to it at a slow and steady pace. So work your way up. I recommend starting at about 1/3 of your normal mileage. I know, it's a big cut, but I would start at 1/3. I would do it a couple times per week, 2 to 3 times, no more than that. And then make sure that your foot is continuing to feel okay. And again, my litmus test for that is always foot pain in the morning. So do you have that pain in the ball of your foot first thing in the morning? That's what you want to notice as you're returning to any activity, because it can take a while for this to heal, and it can even take up to 9 months for it to heal completely. So as you're getting back to your activities, you want to be really, really mindful of what's going on. Now, it does not mean that if you completely eliminate your morning pain and then you go for a run, and let's say, you know, you cut your distance down to 1/3 and the next morning you start to have a light amount of pain, it doesn't mean that you have to completely eliminate your activity. What it does mean is you need to continue being diligent with the program that you created and that we're going to discuss next. All right, so what can you do about metatarsalgia or pain in the ball of your foot? Well, the first thing I have found to work with my people is really soft shoes. This is where those Hokas come in really, really handy, or there's some really soft Crocs that are really, really helpful. Your feet will be happy with really soft shoes. Now, I don't recommend Hokas necessarily for everybody, but I can definitely say for my patients with metatarsalgia or plantar fasciitis, Hokas and some really soft shoes will make you feel a lot better. Now, if you struggle with that metatarsalgia or pain in the ball of the foot, along with the soft shoes, I would recommend a metatarsal dome. So you can either get orthotics that fit in your shoes that have a metatarsal dome, or you can buy just little metatarsal dome pads and put them in your shoes on your own. But what they do is they help to lift up these met heads, and so it decreases the pressure on it. Now, if you're putting it in the shoe yourself, here's what you want to know. You want the dome to fit behind the met heads. So the met heads are here, okay? These are your phalanges, these are your toes. These are your metatarsals, these are your met heads, the metatarsal heads, met heads. I know it's super creative. You want the dome to sit here, along here, so that it lifts up these metatarsals and decreases the stress onto those met heads. It's really important because if you put it right over the met heads, or you put it right here, that's going to increase the pressure to the met heads, which is going to increase your pain and not do what we want to do. So if you're noticing that you have increased, you've tried the metatarsal dome and you're like, I feel like it actually makes things worse, I'd encourage you to slide it back a little bit. That'll probably help a lot. Now, this is where an orthotic or an insert can actually come in handy, because it will have the met head in the right place. I mean, supposedly you may have a weird foot shape, but I have really big feet and I got some because of a different issue, but it's really, really helpful because it already has that metatarsal dome in the right spot. It lifts my metatarsals up and decreases stress on my met heads. Now, I wasn't looking for it specifically for that. My problem is that my feet are really, really flat, and so I was putting a lot of stress through my big toes, which was causing them to kind of shift over to the side. That's a totally different issue. But over time, it could have led to metatarsalgia. So I saw some symptoms that didn't look good, and you know I don't want to stop running because I have pain. So I use the metatarsal dome, and it works for that too. All right, now you're not gonna like this one, and I super apologize for it because I usually don't like to tell people to stop doing things. However, we've already talked about the fact that it's really hard to get blood flow to this area, and this area gets inflamed and becomes difficult to heal. So as much as is reasonably possible, I need you to decrease your standing and decrease your walking. And I don't like to say that, and I don't say it lightly. You guys know, if you've watched me for any period of time, that movement is life. We want to be moving, having pain-free movement so that everything can heal. However, this one's a little bit different. When we're standing, when we're walking, we're actually increasing the injury. So there's no two ways about it. We need to decrease it as much as is reasonably possible. Now, I am not saying go sit on the couch and be a couch potato for the next 6 weeks, okay? But we need to make sure we're getting regular periods of rest. So this is not the time to go walk around Disney World for 5 days straight, okay? As much as you can, as much as is reasonably possible for your day-to-day activities, I want you to decrease walking and decrease standing, which does mean if you have a sit-to-stand desk and you've been standing to get the health benefits of that, which is super fantastic, and most of the time I totally love that. But if you're having pain in the ball of your foot, I actually need you to sit. I need you to sit in a really good posture to make sure you don't have any hip or low back pain. But I do need you to be sitting for a while because we need to take some stress off those feet so that they can actually heal completely. Okay, so what about running? What about biking? What about hiking? What about the other activities I want to do? So it's actually really interesting because this one goes against what you would commonly think. Running can actually be less painful than walking. And I know that seems ridiculous because usually with running, well, always with running, you have increased force through your feet. But because of the gait pattern with running, it can actually decrease force through those met heads. So, and you get that quick push off through those toes. So running actually may be more comfortable than walking. And if you need to have some form of exercise and you're like, listen, I gotta be able to do something, running actually may be a really good option for you. What you wanna do is assess how things are feeling the day after the run. Now again, running may not be painful, and it probably actually won't be, which is fantastic, except for you can still be causing damage even if it's not painful while you're doing the activity. So look at the pain the next morning. Is it increased from when you went running? Then you'll know if running is okay for you. Now biking. A lot of people think, oh, well, biking would be great because I'm taking pressure off of my foot. However, when you clip in, your clips are right by that met head. So for some people, especially as you're doing that push down, or even that pull up because you're getting that toe mobility, which is gonna put stress through those met heads. So some people will actually find that they have more pain after they go biking if they have metatarsalgia. Now, what you can do potentially, at least you can try and see if this works for you, and I know my bikers are gonna go crazy and say this is not possible, but just for a short period of time, what I need you to do is not clip into your bike. So just wear, I know, a regular pair of shoes. I know, just like normal people, just wear like a regular pair of tennis shoes. So instead of having the force go through the ball of the foot, you have the force going more in between the ball and the heel. So right in the middle of that arch of the foot. And that can be really, really helpful because you don't have that extreme force right on those met heads. And it's only for 6 weeks. You don't have to do it forever, but for right now, while this tissue is trying to heal, if you want to go, especially if you want to go for a really long bike ride, that's something that may help to decrease your pain. Now, a lot of people will ask me about hiking too. I live in the Pacific Northwest, and so many people like to go hiking, especially when it's a nice day outside, although we'll go hiking when it's raining outside too. The trouble with hiking is that you do have increased force through those met heads as you're going up because you get that toe bend. but also as you're going down for a lot of people because they'll scrunch their toes to try to stabilize themselves as they're going down. Does that sound like anybody I know? So hiking can actually be extremely provoking because of the increased motion. Now, when I'm talking about hiking, I'm talking about elevation gain, okay? Walking on a trail can actually be super helpful because it's a softer surface, so there's less force going through those metatarsal heads. However, if you're hiking and having elevation gain, that may actually be more aggravating. Again, I would recommend, if it's something you do regularly, give it a shot, see how your feet feel the day after, keep up with your program, because it's a matter of finding the right mix of elements that are going to get you the pain relief you're looking for. So now it's over to you. Drop a comment below and let us know what you've done to treat your metatarsalgia or pain in the ball of your foot, or if you knew that pain in the ball of your foot was actually called metatarsalgia. Now, if you think what you have is actually an Achilles tendonitis or a plantar fasciitis, I would definitely encourage you to check out our channel for videos about that. Have a great day, everyone.